I'm here to talk about the fertility investment boom in India and how we can bridge that IVF gap in the country. We said in the previous the previous panel also, that it sadly carries the image of being a rich person's solution. So in this panel, we want to discuss on how we can bridge that gap between people. Uh, can we have a short introduction, please, first?
I'm Dr. Abha Majumdar, and at present I am an emeritus consultant, past 70, and I'm also the director of the IVF Center of Sir Gangaram Hospital, which is in New Delhi.
I'm Dr. Sunil Jindal. Uh, I'm an andrologist basically, but we also run an IVF center in Meerut known as Jindal Hospital. And I also love to be a YouTuber.
I'm Dr. Ashish Sood. I'm director of Nilkant IVF Hospitals, Rajasthan. And presently we are working in Udaipur, Jaipur, Kota, Ajmer, Bhilwara, and Jodhpur.
I'm Dr. K.D. Nair. I'm the Chief Consultant, Akansha IVF Center in New Delhi.
I'm Dr. Sonia Malik. I'm the Chief Clinical Mentor for Nova IVF Fertility across India.
I'll start the discussion with a very important question that in India there is a huge unmet need for fertility treatment. So, according to you, what is the scale of the IVF gap, and why do you think that it has, attracted so much of investor interest?
Yeah, all right. So if we look into the SART data, we find that in US about 2.5% of childbirths annually are contributed by IVF. In our country, we have about 3 lakh IVF cycles across the country, all centers, all tiers. And taking a live birth rate of about 30%, we have about 1 lakh babies in a year. And this is not data from today, this is about 2 years ago, 3 years ago. Now, if we look at our total births, they are over 2 crores. So it makes 0.5% of our total birth. So IVF contributes to only 0.5% of total birth in our country. Having said that, look at the gap. We have 15 lakh cycles to go a year to be able to come at par with US, which will take maybe 10, 15, 20 years. Looking into the 2-tier, 3-tier, and then all your investment problems, the problem of our country, which is the economic strain which we have in accomplishing treatment on high ends like IVF.
See, I look at it in a very different fashion. I was reading the data, your data in fact, I was reading. It is, I think, about 1.5 to 2.5 lakh cycles being done, while what you actually think is going to be about 1 million which be done. But the question is, we are talking at the moment about IVF real estate and not about fertility infrastructure. Now, if you look at it in a very, very different fashion, what an investor thinks is, 3 things are met by an investor in IVF. Number 1 is the pain of not having a baby, the demand which is there, which all of us can see. And the third thing is that you can standardize protocols and systems across and scale them multiply. So these 3 things are met, therefore the investor comes here. Now, an investor is given a picture that it's a great country. From 1.5 lakhs, you can go to about 1.5 million. It's 100x. But just look at it in a different fashion. How many people and what percentage of people in our whole population can have house help? I'll give you an example. Now that percentage is less than 0.5%. Now anybody who undergoes an IVF, I'm talking of IVF at the moment, would be any human being who at least would have a house help. So it goes with the premise that everybody can afford IVF, that the scaling to an investor is 100x. While the truth is, not everybody can afford IVF in our country. And IVF is not fertility treatment. IVF is a part of fertility treatment, which means if there's a big textbook, I mean, it's just one of the books on the shelf. So what I would feel is that the scaling up of IVF can only be done when a structure is made of education, education across platforms to every human being. Fertility knows no geography, but IVF has a geography. IVF you will find normally in the larger cities. Even tier 2, tier 3 cities have it. So to be able to have a structure where education is there, and then even the smallest of places have people where the man and the woman are worked up properly, segregated for all those people who actually need IVF, and brought into a structure of IVF would be a beautifully scaling business. I mean, that's the way I would look at it.
Can I come in between?
Yeah, sure.
So, I have a different premise to it. The problem with IVF has been that it started in the private sector. We did not begin in the government sector. Even today, we have most of our students coming from the medical colleges not trained in infertility. I'm not talking of IVF, trained in infertility. And IVF is the super specialization thereafter. All of us sitting here are actually trainers for our doctors, right? So if it has started in the private sector, you would expect that there will be a cost to it, right? The other factor is that India is a populous country. We were always a populous country. We never looked at the total fertility rate, and we never looked at the declining fertility ever. It's only in the past couple of years that we started talking about declining fertility, because we are worried about the number of patients, the number of people in that age group who are going to be able to earn for us. We are worried about the aging population. So that's why we are talking about it. And that is exactly the reason why IVF has grown in the private sector, and so it is not affordable, because private sector has its own costs. And then when you're talking of the investor, why do they find it easier? Sunil has very nicely mentioned that there are 3 points to it. I will add one more point to that. It's easily scalable because it's a single specialty, right? So therefore, to scale a single specialty is always easier as compared to a multi-specialty, hospital or a place. So that is why investors find it easy. It's a set protocol, it's set everything. There's no really big, you just have to get in and find the right people and start doing it. So that is why I feel that, India has been lacking in this. We are catching up, and we will definitely be able to scale it further. I come from an organization which has scaled tremendously in the last 3 years. From 19 centers, we are now 120. So that's the amount of scaling that has been done. So people are doing it. Dr. Sood from Udaipur has scaled so much. So people are doing it. It's not that we are not there. We are.
That's it. Anybody? Do you want to add something, sir?
Presently, India is doing around 3 lakh IPO cycles. And there are analysis which says that it can reach up till 3 to 5 times of the number of IPO cycles by year 2030. So presently, if we take by numbers, India has around 200 IVF cycles per million population, as compared to Europe, which has 1200 IVF cycles per million population. No, sorry, US 1200, and Europe is 2000 IVF cycles per million people. So this private equities and other investments, they see as a huge potential for the investment, and the potential for the investment and the return on long-term basis. This is basically their idea that whatever they are investing and how fast they can grow and how much they can grow in the coming times. Secondly, there is a rising demand because of the lifestyle, because of increased age of marriage, because of sedentary lifestyle. Secondly, one very important aspect is medical tourism, because the cost of IVF cycle in India is far more affordable than most of the Western countries. And gradually, India being a very hospitable country, there are companies who are now working towards fertility tourism just not providing the IVF services or the medical services, but now they are making a combination or a package where they are combining wellness into that. And one of such projects have come up with Udaipur, where it's a heritage city. We have lot of palaces, we have havelis, and people need for IVF treatment a cool, calm place where they can mentally relax. And they have built up packages where they have built-in yoga, meditation, and an IVF patient, say, if he has come to a clinic for a treatment, he needs to stay for 12 days or 14 days, and he has to visit the hospital for 1 hour. What the patient does for the whole day. So they have built-in pottery classes, puppets, paintings. So this is the way they have built in the packages here. So they are providing the services from airport to airport. And that is not only for foreign patients, but also for the domestic patients working in tech industry in the metros, who can work from home, who can work from their haveli where they are staying, and everything is taken care of. So that is again a huge investment potential for these countries. Then third is lot of big global private equities. They have already invested in few IVF chains in India. So this further boosts the confidence of the finance world to further invest into the IVF world. And most important thing is that they have a clear exit pathway in form of IPO. And this all is leading to the increased investment in the IVF industry.
I agree with you, Dr. Sood, but there is a difference. This class of patient is very different, which are staying in
Right,
Haveli and
yes.
this thing.
I also
What the
agree with
private
you on
equity
this.
is looking up is a different class of patient. You see, all of us agree we are doing 300,000 cycles per year, while we have a requirement for almost 4 times of this. This is the patients staying in tier 2, tier 3 cities, which are being targeted by the private equity. This is what they are trying to target. This class of patients staying in Haveli, this thing, this has already been targeted. They have already been looked after. It is the patients staying in tier 2 or tier 3 cities which they want to target, which is the real growth for IVF sector in future.
Just to,
Yes.
Yeah.
just to add to
Agreed.
the investment brings in standardization. The investment brings in technology, not only at the local level, but also the technology from the global world. Because now with this investment, the big groups or chains or they are getting connected to the global technology, and there is more exchange of technology from that world. And now tier 1 cities are exhausted. So now they are moving towards tier 2 and tier 2 and tier 3 cities, where the IVF industry is scattered. They are individual owned clinics, not standardized. And this will bring the technology to those people who are not able to travel to metros for their treatment, where the cost is not only the cost of treatment, but also cost of traveling and staying is very high. So this is how the investment helps in propagating the services to the underprivileged or the people who don't have access to the, I don't say they don't have access to the treatment. Yes, they have access to the treatment, but what we are talking of a protocolized, standardized, transparent, high quality centers.
Yeah, but the bottom line for IVF is still the pricing, the finances. Whether the patient is in tier 1 city or patient in tier 2 city, it is the finances which matters.
Yes.
So financing thing is also gradually improving because a lot of corporate people have started in giving support to their employees for their fertility treatment. There are a few insurance companies who are also now have started. After a few years of insurance, they have started giving the covering fertility as a part of treatment up till 3 cycles. Then government initiative is also come into play with National Health Vision and Ayushman. The government is putting up centers.
Ayushman doesn't even support emergency treatment in most major cities. So, it is very sad to say that we bank on Ayushman so much, but it doesn't support, and last of all, it will support IVF.
Ma'am, in Rajasthan,
No, in
Rajasthan
tier
government
2 and
has,
tier 3
yeah.
it does, because there the cost is less above. In the
It-
metros, it is different.
We're
but
talking
yes,
about IVF right
Yes,
now.
yes,
Yes,
that's
ma'am.
exactly
So-
what I'm saying.
I mean,
It does,
Rajasthan,
it does.
Rajasthan government in public-private partnership has initiating opening of the IVF centers in government hospital, and they fixed the price there at 70,000 rupees, including all. And now medical colleges in Rajasthan are coming up with the IVF center, so
Yeah,
that
that is true everywhere. Even in Delhi, the medical colleges are catering to IVF.
I like
How far and what are the results and how far they are really looking into the cost factor. There also, when patients come from medical colleges, they still have to spend a substantial amount. So, saying that the government sector is looking after and it is absolutely free as Ayushman is supposed to be, it, I don't think it really happens in true life. I have faced it. I have faced it with my own relatives and it has been denied everywhere. IVF तो बहुत दूर की बात है. Even emergency treatment, cancer treatment has been denied on Ayushman card in the Delhi metro city.
Uh, So we were talking about number one scalability, we were talking about investment. Now, for any investment to be ultimately successful in terms of scaling and investment growing, in a deeper concept, three things are needed. Number one, in an IVF industry, it would be probably a very good quality of treatment. The second thing which would be needed will be accessibility to a large part of the population, for which cost again is a driving force. Dr. Sood said something beautiful. The Haveli story was very nice. I think for investment to come in, the story of foreigners coming over here and doing the work at a reasonable or an expensive price is fine. But the scaling of this industry ultimately has to be done by a common Indian. And a common Indian, if you divide it into three major portions, you'll have India 1. India 1 is which can spend anything and everything which they want, which is less than 0.2% of the Indian population. So in this country, for a person to have at least 3 cycles, I'm talking of 3 cycles, at a reasonable price, he should have at least 5 to 6 lakh rupees to spare. The second portion of India is one area where they're able to lead a life where the children's education, their stay, their food is met with. And the third is who survive on the government ration. Then the percentage of people in this country who survive on the government ration is about 72 to 76%. So taking the complete population of the country and trying to scale the IVF business to a level where about 1.5 million or 2 million people will be the future, probably is something which has not been taken in a very clear perspective. What I personally feel is that what we should talk about is a fertility infrastructure where in every small medical college, like Dr. Sonia said, like Madam said, there should be people who are educated, trained to look after the man and the woman for fertility, and this patient should be treated over there. If 100 people are infertile, only 20% are going to need IVF. 80% would need that treatment at that particular level. Now these patients, when they come in, they filter in at a lower cost, with Ayushman, without Ayushman, will probably make it a scalable business.
I think you see, basically we have to restructure our cost of the IVF. We have to bring it down so that it is affordable to the major population. The major population is still away from the IVF because they think it is unaffordable. We can bring it to a affordable level with a sustainable quality. That is also important. We cannot reduce the quality and say make it IVF for 50,000. No. If IVF is say 1.5 lakh, it can go up to say 1 lakh. You can maintain the quality. It can go down to lot of more people. We need more patient to increase the cycle. That is where the equity is looking for. They are looking for increasing the cycle. Cycle is coming only from patient. When we have more patient who take up the cycles, isn't it?
I think again I'm digressing again. So in the sense that look at the population of the country that is coming to the government hospitals for any kind of treatment. Majority is going there. The 70% or 80% that Sunil had mentioned just now goes to a medical college or goes to a government college. And why are we wanting to bring that into the private sector? Is there a need? I mean, they cannot afford it. Why are we stressing them so much that they should only come to us, So the idea is essentially that we should have a different segment of our population. Middle class can come in and the upper middle class can come in and the rich. But the poor patient who does need IVF needs to go only to a medical college or, a government institution. So I think that is where we should scale. It shouldn't be scaling up us. We are already very well. We are doing very well in the private sector. And as Dr. Kelly is saying, we need to revise our prices. But again, there is a problem with revising the prices and bringing it down because of the social media, sorry to say. Because how can the patient know which is a good IVF center and which is a bad one, where everybody is actually advertising for 70,000 a cycle or 50,000 a cycle? How do you know whether this particular person is doing the job or not? But what every patient needs to understand is that there is a basic cost to IVF treatment. If the medical college is charging 70,000, we cannot do it for free, right? And there has to be a cost to the doctor who is performing it. Medical college is not charging the doctor's fees, only for the services that they provide. Here we are also charging for ourselves, which is true and justified. So then how can we have a cycle in 70,000 or 50,000? That is what you people should actually tell the patients.
Yeah, here
That is the problem.
I agree with Sonia so much now, at least on one point, that we have to have two segments. We cannot unify the whole country. That 70% who goes to RML or who goes to Maulana Azad or who goes to all the medical colleges for treatment, they wait in lines, they wait for their turn, they wait for everything. That is one segment which needs to be taken care of by our own government, like they took care of Ayushman. There is another 25 or 30% who are more inclined towards going to the private sector for any treatment. May it be a surgery or may it be medical treatment. That is the one which needs to be explored and which is being explored by these investors who are coming in. And that is where the growth is happening. And pardon me for saying, one center or one chain, which is known as Indira, we all were very afraid of it, we were not happy about it. But I think they've palpated the right thing, making a great good center and having 11 clinics all around. Nursing home ka zamana chala gaya hai. People don't even like to go for a normal delivery to a nursing home. They want to go to a hospital where there are ICU services, where there is a bloodline, so that no risk is taken. Here also, in IVF centers, one good center, and then having patients come there to use the soul, which is the embryological services there, would give us much better unified results rather than opening small satellite centers. Cost cannot be met in small centers. You have 10 patients a month. You are trying to take out all what you invested through those 10 patients. You have 100 patients somewhere. You will divide your cost of everything amongst that 100. And that is when you can reduce the cost also. So this is what my thinking is.
And India actually is one of the cheapest countries for IVF.
Yes.
I mean, we talk of the cost at the moment. I don't think anywhere in the world could IVF be done at a little price.
All Indians who stay in US, they come to India to have their IVF, go back with the baby very happily, where they feel that they can talk to the doctor, they have access. In US, they don't know what is happening to them, and at the end, they spend 25 lakhs down the drain in one cycle.
In most of the panel discussion, every time we always talk a lot about the cost, but we never talk about research. In IVF, for most of our equipments, I think we are dependent on the Western world. For media, I think it's almost 100% we are importing, except for some medias we are importing from the Western world. So how we are going to get the cost down? How we are going to get the cost down? Nobody talks about that. Now, if you talk of the cost, I think IVF in India must be one of the cheapest in the world.
It is.
And second is cost is important, but more important than cost is standardization, results which are reproducible. rather than clinic talking of something, but there is no transparency because there is no data, and that data is not on the public platform where public can go and check what is the quality of or what the results the center is having in last 1 year or 2 years. So I think these are the more important things to be addressed, and good quality, reproducible, good results. What we are talking of AI and 80-90%, reaching up to 80-90% doesn't come cheap.
The advantage also of having chains and having multiple centers and having investors is that they come with a lot of money, and so the investment is there to do. You are at a slightly more liberal situation than the others. Like I have seen both the worlds. I had my own chain, my own centers, and now I am with a corporate. So they have more money to spare, and hence, like everybody is saying, the data entry, data collection, data entries is stringent, the quality control is stringent, the technology that is used is the best, they want to use the best, and having, doing these things, it does take money. It does, you do need it, and therefore, and every investor is coming with that idea that they have to earn a bit also out of it. But having said that, I know that what is happening in India is it's not such a big margin that they are getting. No, because we have our own shortcomings, our own limitations and shortcomings. Yet they have understood it, and therefore, it's not so bad to be in a chain, because then you are at liberty to work together and see better results. If you are working in a group, you can talk to each other much better, as the other countries are doing. And unfortunately, from our country, all of us are producing so much data, but there is nothing available. We are not publishing anything.
We are not
We are
publishing.
not publishing anything. I think out of all of us sitting here, he has got the maximum number of publications. So basically, that is where we are lacking, isn't it? And that can come only when we have groups who are working together and collating their data. That is the next stage for us. Rather than trying to, because see, how is the patient going to understand that this country is doing well in IVF? They don't know our results. So हम बोल देते हैं कि हम 70% है या 50% है. How do we prove it? But if we have published data, then yes, we can show it to them. That makes sense. So I think the next best step is to work together. That is what the ART Act wanted, that the level ones should come together and collaborate with one another. But that didn't happen. As Abba is saying, one chain is forming multiple centers, a spoke and hub model. That is within a chain. But as such, otherwise, doctors are not coming together to work together. That is where we are.
I think in course of time, we are going to have our data also with the new ART law coming in. We are sending our data every month to the authority, government, and in course of time, the government should be able to publish that data which they are collecting. Because until unless we publish the data like USA, SAT is publishing the data yearly.
China.
So they know how many cycles this particular center is doing, what is the success rate in this center, what is the success rate in my center, what is the success rate in Dr. Sonia center. Everybody, it is on the web. It is open to everybody to see. So until we start publishing the data, that is one of the important thing for future. It has to be there.
A centralized data entry is so important. But then I have a lot of hope. I remember one call to US would cost so much. Or if we were even out of our city, we would look at minutes ticking through, that how long a cost is going to be of a phone. If we can walk from there to absolutely free cost, as number of times to as many of minutes from here to even the US, I think the cost thing will also work out somewhere with us. Like Dr. Sood said, that we are importing everything. Slowly we are going to change our strategies of getting the media, the equipment from our country. I don't think it's far behind. It's just a matter of a little time that we will enter that situation where things would cost little less to our patients, will be more available to that population which should have it and doesn't have it.
This is a cue to Samarth to start manufacturing needles and culture media in India, in-house, rather than giving us only gonadotropins.
No, in last few years, there have been few companies who have manufacturing ovum pickup needles, ET catheters, IUI catheters were already there, syringes. So I think gradually the things are changing. But till we don't manufacture, make in India, I doubt that we will be able to get the cost down.
No, I personally think hormone price in this country is the cheapest in the world, cannot be
Minimum,
more.
yes.
Recently, I had gone for a program in Thailand. Over there, it was the FFA program. And over there, Mr. Kota Bhagi was there, Rajiv was there, a lot of people were there. And there were people from Thailand. Thailand, I'm not talking of the US. US people also were there. And they were talking about the cost of the IVF cycle and the cost of the drug. So cost of an IVF cycle, I'm talking of a normal IVF cycle in Thailand, in a reasonable center in Bangkok, is between 9 lakhs to 12 lakh rupees. And the cost of the hormone over there is 4 times the cost of the hormone which is coming to us in India. The cost of the disposable, you'll be surprised, which I was talking to them about. Mr. Kota Bhagi also was there. The cost of a disposable was more expensive than what it is available in India today, over there. So if you look at it, the cost which is being provided to us for the hormone is very reasonable. The cost which we get of the disposable for most of the things compared to the world is very reasonable. And the cost which we charge is very reasonable. So ultimately, thinking of decreasing the cost or enhancing the quality of what we do with transparency will be probably a better way to look at it. And more importantly, if we want to scale, India as a great country should have a better income, we should be earning more, and we should be a country where all of us can afford IVF. I won't say a maid servant because 50% will be working then, but a car, a vehicle, education for people. And I think that country would be a country where IVF could be done at the cost which we already are doing, the cheapest in the world.
Dr. Sunil, you know what is the per capita income in India? Let us be very clear about it.
That is what I'm talking
I think
about.
about
So
70,
therefore I'm saying it
75%.
should improve.
So you cannot increase the per capita income overnight. So you cannot simply increase per capita overnight. You have to work very hard for next maybe 10, 20 years.
For them, we have the government sector to look after them. And we
Doctor,
have to
our
promote.
government sector is, you cannot have a different category that because you go to government sector can only do IOA, nothing more than this.
No, they have to develop it.
It's a different-
And there would be a waiting, there would be a line.
Doctor-
This is not emergency.
Dr. Nair, I'm talking of a different perspective altogether. What I'm saying at the moment, this is the reality of the country. Trying to think that you could scale something
No,
to a
we
level
cannot.
with the present income of the country is a different story altogether.
I think this brings me to my concluding question, hoping to stay optimistic on it, that in the next decade or so, half a decade or so, do you think that India can become a global hub, especially now with the ART Act and how we're talking about India being the cheapest when it comes to IVF. So do you think India can emerge as a global hub for fertility care and reproduction medicine?
I think definitely yes. Because with the ART Act in place, the investors have so much more confidence that it is not a clinician derived center where they are going to have some rules according to the clinician's whims and wishes. So they will have more confidence, and the price is definitely less. All Indians who are abroad sort of come back here, have their IVF, get pregnant and go back. So if they can do it now, they will do it with more confidence because the cost is at least 10 times lower than in the countries where they are living. So it will become.
I think there should be something like Heal India movement. So it should be Heal India, where a lot of people can come to the country, but 3 things would be needed. Number 1 would be needed outstanding results, transparency, and the third thing which would be, of course, bringing them here will be cost. So if these 3 things are there as an infrastructure, I again say, not IVF clinic, estate, fertility infrastructure.
Definitely, and you will see in coming times that India becoming the global hub. Presently, India the second highest number of cycles, and it is projected by 2035 India will be the first in the world. But this can come only when we talk of technology, we talk of standardization, we talk of transparent results, rather than always talking of how to get the cost down when we are at the lowest point. Now, there are 2 sectors, as my senior said. the sector who can afford, a sector who cannot afford. Now, there is a limit to which a private center can come down on the cost, because after that they will be compromising the quality, they will be compromising the transparency, and most importantly the results. So as a doctor, I will like to invest in technology, I would like to invest in manpower, I would like to invest in better medicines, better injections, so that I can give a consistent result to my patient. Because if my patient conceives in first or second cycle, the cost to that patient will be much lower than the patients who are failing for third, fourth, fifth cycle. So this is how we have to.
I think India will be the hub in the coming years, and we will be one of the few countries when we are going to employ artificial intelligence in our labs. Once we employ artificial intelligence, our results are going to be much more standardized, and that is what is going to attract patients from abroad. So that is why we are likely to be the hub of this idea.
I will again. I think India will become the hub only if we are ethical, transparent, and very, very conscientious as a community. You know, because every Indian is looked at with suspicion today. The story has changed a little bit, Mr. Modi. I'm not being political, I'm sorry to say that, but yes, you all know that the blue passport was, you know, thrown away in the dustbin when we used to go abroad. It is looked at with a lot of respect now. So the things are changing, and that is why we are saying that even IVF will do much, much better because of the medical tourism gaining. But then every person who comes to us is very suspicious of our intent. So that is the first thing that we have to remember, being ethical, being honest, and being transparent. Of course, technology, we all want us to be very good, we want our results to be the best, everything is there. But then, until and unless we do this, we will not become the hub.
Great. Thank you so much. Thank you for taking out time and talking to us. It was great to have this discussion where there are 5 different perspectives with one main goal. So thank you so much, and I hope the panel audience